One of the things that I like to do, well, Mr. Richards, please.
Did you see Mr. Godot's comment? He said he's having problems with the mute button.
I did, absolutely. Mr. Godot, let's talk about it after class. I've got some ideas. Okay. You're excited to learn about the gluteal muscles? That's great. Oh my gosh. You are ridiculous. Okay. So, everybody, if you take your hands and you put them way back here and you say gluteus maximus, that's a good idea. If you move them kind of to your sides and say gluteus medius, that's a good idea. If you bring them just slightly forward and say gluteus minimus, that's a good idea. And then if you go even more forward and say tensor fascia lata, that's a great idea too. That's not a gluteal muscle, but I'm trying to give you an idea of how stuff spreads around your hips. Gluteus maximus, gluteus medius, gluteus minimus, tensor fascia lata. So, the glutes are interesting. They all do different things, and they lay over each other like shingles. So if you've ever seen, hold on, I'm just muting somebody here. If you've ever seen how a house is shingled, one shingle goes over another, and it doesn't completely cover it, but it does like this, and your glutes are like that. If we laid down a shingle here in front, this would be your gluteus, minimus. Let me show you this. Sorry. This would be your gluteus minimus. This would be your gluteus medius. It actually goes on top. And your gluteus maximus would be on top of that. They would all be slightly exposed, right? So as I go from back to front, I actually kind of in a way go deeper. So my gluteus minimus is here, halfway on top of that is my gluteus medius, halfway on top of that is my gluteus maximus. I'll show you a picture of this in a second. Since my gluteus maximus is in back, it tends to pull my leg back. Miss Everson, what do we call that when we pull our leg back? What? I couldn't hear you is all. How about extension? Yeah, you said abduction, I'm saying extension. Abductions and adductions happen out to the side of your body. Stuff in front and back is flexions and extensions. So because my glutes are in back, they extend my leg back. That's what they do. And this is why we use them in squats. You don't think about it, but when you squat, to get back up again, this leg has to extend. This leg has to go back to get me up. That's a squat. That's my gluteus maximus. It's why your gluteus maximus is so big. I mean, it might be big because of the Thanksgiving turkey also, but it's big because it has to get you up out of a deep squat. To lift up a human body takes a very large muscle. And that's your gluteus maximus. Yeah. Now your gluteus medius is on the side of your body. Things on the side of your body, like your medial deltoid, which is on the side of your body, tend to do what, Miss Everson? I'm calling on you again because now you can use your answer.
My medial deltoid?
Well, yes, but also, what do you suspect your gluteus medius does since it's on the side of your body, just like your medial deltoid? And I'm calling on you so you could use the first answer that you gave.
Abduction?
Yes, it pulls stuff out to the side. So when you guys are sitting here doing hip raises, that's your gluteus medius. So the way, and I'm not trying to be weird here, I'm just trying to give you ways to remember this. Your gluteus maximus is your booty. Your gluteus medius is your hips. When you're like, oh, you got big hips, you got big gluteus mediuses, right? And they do other things, but mainly they help pull your hip out to your side. Gluteus minimus is kind of in front. So what do we suspect it does, everybody? Mr. Richards, please.
Flexion.
Yes, flexion. Now, I am oversimplifying. The gluteus medius is a little bit in front too. It can help with a flexion, and the gluteus minimus is a little bit on the side. It can help with an abduction. But the fact is, if you had to say the majority of what they do, the gluteus maximus's main job is it's in back and it's to extend the leg. The gluteus medius's main job is on the side that abducts the leg. The gluteus minimus is in the front a little bit and it flexes the leg. So Mr. Richards, since you correctly identified that it flexes the leg, the hip, the coxal joint, the acetabular femoral joint, since it does that, what kind of tilt can it create in my pelvis?
Anterior.
Yes. So it is yet another culprit of anterior tilt. And I make a big deal out of anterior tilts in this class because they're fairly common problems that we see in our society, because we have a society of people that make their living by sitting down. I don't mean we have a lazy society. I mean we have a world now where we use computers. And people sit down to use computers all day long, and when they do, their hip flexors can shorten. If my hip flexors shorten, when I get back up, I'm like this. And then I come in, I tell you I've got back problems. Well, what I have is maybe a tired back. That's different than a back problem. I might actually have short hip flexors, and if you can extend them, then I won't have a back problem anymore. Yeah. And we're learning that we actually have a lot of hip flexors that can create an anterior tilt of the pelvis. Okay. Yes, Ms. Carrillo, please.
How would you be able to tell the difference, I guess, to narrow down it's the gluteus minimus? Like, what kind of assessment would you do?
I'm sorry. Say that one more time. I'm sorry.
Oh.
No.
So you said that if it could be a tired back because it's basically arguing with the gluteus.
How do you know? How do you know if it's possibly short hip flexors?
Yeah.
By trying to do a hip extension on them and seeing how well that goes. Right? If you can't get their leg to go back easily, they should only go back so far, but if their leg won't go back easily, it's because it's getting stopped by hip flexors there, and that's a problem. Yeah. Yeah. And let's sadly use me as an example here. So let's suppose I work at a desk all day long, and I've got a belly. So even though I like to lay on my stomach, do my legs fully extend when I lay on my stomach if I have a belly here? They may never fully extend because my stomach is keeping me kind of like this when I'm laying on my stomach even. So I may never get this flattening out experience. So I would be a great candidate for shortened hip flexors. But anyway, ma'am, you check the range of motion on the hip. Yeah. And also you just palpate those suckers. If they seem really tight, then they're worth working. Yeah. Miss Clayton, please.
But how do you do that? You pull their leg like back, like when they're prone. You flex their knee and like pull it back.
Yeah, that's what I do. It's not so much I flex their knee. It's that what I do is I put my leg on. I get them prone, face down. I put my leg. Some of you guys have seen me do this. It's the iliopsoas stretch, and I do the iliopsoas stretch on them and see how difficult that is. And it tells me all sorts of stuff. It's an iliopsoas stretch, but it actually helps stretch their other stuff. But yes, I try to, yes, Ms. Clayton, very simply put, I could have them prone. I could have them bend their leg and just lift it up and just see. If their whole body comes with it, that's a problem. If the leg just lifts up, that's excellent, right? Because if the leg just lifts up, it means their hip is flexible enough to let the leg lift up. Even if it's just a couple inches, that's great. It means it can go back. If I lift it and the hip doesn't really bend and the low back kind of comes up with it, then that suggests that the hip is too tight. Yeah, it's a really good diagnostic. And again, by the way, we don't diagnose, and clients will try to get you to, but I'll go, hey, it seems like your hips are tight. I think that could be causing the problem. That's why I'm going to work them, that kind of thing. Ms. Rader, please.
Oh, I was just going to say that I did that during the massage clinic to anybody who wanted to do any stretching. When they were prone, flex their knee so that their, leg was up, and then grabbed underneath their knee and lifted up their quads basically, so it was you could totally tell on most people, one side would, they say, oh yeah, you can keep going, and on the other side, it would just go up like 2 inches and just stop.
So that's neat that you were doing that. By the way, I'm not going to get into this today, but we will get into it. Ms. Rader just pointed out that sometimes people's hip flexors are tight on one side and not another. What do you suppose happens when they're tight on one side and not another? I've been talking about very simple scenarios where you're either anteriorly rotated or posteriorly rotated. But if you get one side that's tight, you can actually have a torquing. You can actually cause a torquing of the body, which is a whole other set of problems. But Ms. Rader's actually already started to identify clients, and you'd work the tight side. And that you will even sometimes see people that kind of walk to you like this. They're kind of torqued, right? I'm exaggerating here, but they're kind of torqued because one side is tighter than the other. Mr. Richards.
Would you ask them to do that motion, or would you do it to see if it's tight? Because obviously, if they go to extend their leg and they can't go past the point, then it's tight. But if you did it, that muscle could be relaxed from them. Is that?
I want to see passive range of motion, just me doing it. Yeah.
Okay.
Yes.
So you wouldn't have to do it like lift their leg off the table prone to see how far they can.
No. By the way, sometimes you do. So these are really good questions, but they're actually fairly deep. So if I do it, it's passive range of motion, right? They're passive. I'm doing the work, but they're passive. And passive range of motion just lets me know how far you'll bend. And passive range of motion is really helpful for me to know, can you get your hips in the right position passively? We tend to use active range of motion to make sure your muscles are firing well. So, like, if I can raise your arm up over your head, but you can't raise it up over your head, that suggests there's a nerve problem that's not firing the right muscles. I'm testing the joint range of motion by moving their hip or their shoulder. If I ask them to move it, I'm kind of testing their nerve firing ability and things like that. So you're just testing different things, if that makes sense. Yeah. Yeah, no, it's interesting stuff to say the least. Mr. Craven. Yes, sir.
Yeah, so no, I had it. The sun's shining on me right now. It's like taking all my energy.
Take your time, sir.
So like stretching people, all that, great. But do you know like the main common cause that would cause somebody to have like a torque to them?
No.
So like if
I don't
you
actually.
knew that, and like you can kind of give them advice and like, hey, maybe avoid like sitting this way or like.
Well, that's what I would guess. I would guess they sit cross-legged when they sit at their computer. I would guess those types of things. That something they're doing is uneven.
Yeah.
Right?
Like
but also, sir.
The other,
yes. One leg could also be longer than the other.
Right.
And so they could be uneven structurally speaking, like their bones could be uneven. And all of us, by the way, are at least minutely uneven. There's not a person in this room that has exactly the same length of legs. There's no way. But some people it's more exaggerated than others, so that could be a problem. And it might just be something they have to live with that the massage makes better, but you're never going to fix. But it also could literally be the way they sit in their chair. My girlfriend is a dental assistant, and all of her assisting is done like this. All of it. So even when she's sitting in a chair, she's torqued. So that, because she's always coming from this side of the table, she's always doing that. The dentist is on the other side. This is her life. And this is not good. So one of her hips is flexed, the other one's not, things like that. And so those type of lifestyle things, absolutely, sir, could cause it. Yeah. And they'd be kind of things you would expect. I don't mean you expect like off the top of your head, but you'd be like, yeah, you're not sitting or standing straight. You're doing something where you are rotated and now you have a problem staying rotated. Yeah. And Mr. Richards, I know you just stepped away, but I bet you can hear me. The other reason I don't like to ask them to lift, I'm sorry, I wasn't calling you out, I was just explaining. The other reason I don't usually ask them to lift their own leg when they are prone is sometimes their back spasms. It's a hard thing to do, actually, lift your own leg. So if they're already having back problems and I ask them to lift their leg, it causes them to tighten up all this stuff in back. And it's not usually a good idea.
It's because of when I went to chiropractor, I need to do that to see how tight my lower back was before he, cracked me into place. Kind of.
Yeah. And he might be doing it for some other really clever reasons. Sometimes they have you tense up certain muscles to kind of get you ready to adjust the other way and things like that. But yeah, and he does care. By the way, your chiropractor does care about pinched nerves. He doesn't just care about how far you can go. He cares about, can you get yourself there? Because if you can't, it suggests muscle weakness or nerve impingement, which is also muscle weakness in a way, right? By the way, you can have muscle weakness for two different reasons, right? The muscle could actually be weak. And when you fire it, it's just not strong enough. But the muscle could be strong and it's not getting a signal there, and so it acts weak. Both are weak. Both act weakly. Okay, so let me share my slide presentation. Yay. Boom, boom, boom. Do, do, do. Okay, so here's pelvis and thigh. I'm going to make a big point here in a second, and this picture really helps me do it. This picture is the gluteus maximus right here. I think we can see that, correct? Can you see my pointer, by the way? Good, okay. Gluteus maximus here actually feeds into this band of fascia. Oh my gosh. So the gluteus maximus that almost comes from your lower back in a way actually feeds in this band of fascia, which is called your iliotibial band, that runs all the way down across your knee. Could a tight gluteus maximus affect knee alignment? Yes, it could. Could a tight gluteus maximus cause all sorts of tight tension in your leg and cause tight IT band stuff? Yes, it could. Does the gluteus maximus kind of triangulate with the tensor fascia lata here, and they both kind of come down into a point here on the iliotibial band? Yes, they do. Could the gluteus maximus also tie into the low back and be meant to distribute forces from the low back into the IT band down your leg? Yes, they are. They're part of a fascial line. Super duper important stuff here. So this is often why we work IT bands, iliotibial bands, or iliotibial tracts when people have back problems, because they are very intimately tied into back and hip problems. This is why tight glutes can actually pull your knee out of alignment, and knees do not do well being out of alignment. So it's a very, very significant structure that we're dealing with here, not just because of the size. Mr. Singletary, please.
Yeah, I have a question about massaging someone with sciatic nerve problems. Helping with the gluteals area, would that help with that problem?
Yeah, absolutely.
Okay.
Definitely. It'd be the first thing I would do is loosen up the glutes. Then I would try to get into the lateral hip rotators, but they're underneath the gluteus maximus, so I got to loosen the gluteus maximus up first.
Okay.
Yep, that'd be the first thing I would do. I'd also look at low back stuff because it can kind of show up as sciatic problems. But yes, absolutely, sir. First thing I would do.
The QLs, would that help with the sciatic nerve problem as well?
The quadratus lumborum?
Yeah.
It could. It could. It's not as direct, but it's low back, so yeah. Anything in that low back region, yeah. It's page 275. Ms. Savarino knows where I'm at right now, but I'm about to hop up somewhere else. Hold on. Boom, boom. Oh, by the way, so here, remember I said they're like shingles? There we go. Here's the gluteus maximus. It partially covers the gluteus medius. You can't even see the gluteus minimus because it's underneath the gluteus medius, underneath here. All right, let's move it right along. And Mr. Singletary, this is underneath the gluteus maximus. These are all your lateral hip rotators down here. And the sciatic nerve comes out right through here. In fact, here it is on this side. That is the sciatic nerve. So after I loosen up the gluteus maximus, I'd be going after this stuff.
Okay. No, because I have a friend, he asked me to massage him a lot.
Yeah.
And he's got sciatic nerve problems.
Yeah.
The first thing I thought of was, I remember something you said about the gluteals, so I just went in that area first.
Sure. Absolutely. Yeah. And as long as he's not getting referred pain from what you're doing. So remember, we're working on nerve problems, everybody. If they hurt in the area you're working, it's probably okay, strangely enough. If it refers down their leg, it means you're hitting the nerve specifically and you're probably further irritating it. Just stop doing that particular movement. Move over a millimeter and you're probably fine. But so when you're working on nerve stuff, if it causes referred pain, stop doing it. If it hurts in the area and they're like, oh, it's kind of a deep ache, keep doing it as long as they're okay with it. Mr. Craven, please, sir.
So on the right cheek of the picture in front of us, like the obturators, they look really similar to like the rotator cuff muscles. So are they kind of doing the same similar thing?
Yes. The your deep six are like the rotator cuff muscles for your hip. Is that what you're asking, basically?
Yeah, kind of. Yeah.
That's the way I look at them. Don't get me wrong. Almost all your deep six do lateral rotation, but still, whereas your rotator cuff muscles do several things, but they really are the rotator cuff muscles, for your hip. And in a way, the gluteals are your deltoids of your hip, right?
That makes it easier to think about.
Yeah. And you really do have an anterior, middle, and posterior deltoid, and you basically have an anterior, middle, and posterior gluteal, gluteus maximus, medius, and minimus. Yeah, I'm oversimplifying. And by the way, for those of you who believe in evolution, by the way, I didn't mean that skeptically. I'm just trying to respect all different beliefs here. That makes a lot of sense. If we came from animals that walked on all fours, our shoulders and hips would be very similar, which is why our hands and feet are very similar, right? So it's not surprising that you have, rotator cuff muscles of your hip and your shoulder, and deltoids of your hip and your shoulder in a way, and hands and feet that look fairly similar. They just started to adapt, one more for walking and one more for grabbing things. But you know what I mean? It is interesting that you've got, the same number of fingers and toes, and you have the same number of shin bones and forearm bones, and the same number of arm bones and thigh bones, and ball and socket joints in your hips and shoulders. Like there are similarities there that would suggest that. Anyway, okay. Move right along. We will talk about this later, but this is your psoas major and iliacus, right? Iliopsoas muscle that also helps in hip flexion. Okay, here's the gluteus maximus. This is what Miss Carrillo's been waiting for the whole day. Most people, once they become comfortable with you working their glutes, it's their favorite thing to have worked. It is the center of their body. It feels good. It has a lot to do with all sorts of stuff. Now, what I don't like about your book, and it's not its fault, what I don't like about your book is that oh shoot, so I keep clicking the wrong thing. That's what I don't like. Your book, removes all the fascia from here. And so it looks like, and this is true, it looks like the origin of the gluteus maximus is the posterior crest of the ilium, the lateral edge of the sacrum, and the coccyx. And that's true. But what is covering this whole area is thoracolumbar aponeuroses. Your thoracolumbar aponeuroses, your low back fascia, attaches directly to the gluteus maximus. It flows your low back into your glutes and down your leg. It is how your body actually supports your back and has that weight go down into your legs. But it's very easy to remember, just simply put, that the gluteus maximus attaches to the posterior crest of the ilium, the lateral border of the sacrum, and the coccyx here, down here, your tailbone. And then it inserts into the gluteal tuberosity. That's why it's called the gluteal tuberosity, which is on the back of your femur, which is how you do a powerful extension with this. And another portion flows over into your iliotibial band. And it's beautiful. And this is why its actions are to extend the hip. Now, your book also says it can also help in an abduction, and it can. Some of these fibers are high enough up that they can kind of help do that. Some of the lower fibers low enough it can help adduct. I wouldn't worry about that so much. The two things I do worry about from a structural point of view, especially, is the powerful extension of the hip and lateral rotation. And let me show you why I care about lateral rotation. Oh, stop that. Why is it doing that? Bear with me. Sorry, everybody. Just kicked me to a different screen. I'll come back on with the slideshow in a second. But Any of you karate fans out there, when you see that guy go flying across the room, you know, those punches, those kicks where they're like, pop, right? That is upper body snap, but actually a lot of it's coming from the gluteus maximus. The gluteus maximus causes a powerful lateral rotation. And when you walk, you don't actually walk like this. That's me using my hamstrings and kind of marching to you. It's effective, but not that effective. We actually rotate when we walk. If my leg rotates out laterally, but I keep it stuck to the ground, I go forward. This is how we walk. Obviously, we don't really walk that exaggerated. But, so when you see those explosive karate moves and things like, the person is actually laterally rotating their hips and flying them to you. When we walk really powerfully, we use the gluteus maximus. We need lots of lateral rotation and stuff we do. That's one of the points that it really does. It's why it's a powerful, not just hip extender to get me out of a squat, but it helps me thrust myself forward, right? And if you think about it, when I thrust myself forward really powerfully, I am extending my leg and rotating it out. Boom. That's glute. That's glute maximus, right? And where is it coming from? The center of my body. And anybody who's taken not just karate, but other types of stuff, even dance and stuff like that, you move from the center of your body. You don't actually stick your foot out here and step to it. You propel yourself and land on your foot. Walking is actually an exercise in falling. In real walking, I propel myself forward and catch myself. I propel myself forward and catch myself. And it's the gluteus maximus, even though the walker's muscles are the hamstrings, the gluteus maximus does a powerful extension of my leg here. It pulls it back and rotates it out, but because my foot's stuck in the floor, it rotates me forward. It pulls my whole, and I catch myself. So it's a powerful walking muscle, a powerful squat muscle, it's your explosive muscle, and we actually have rotation in our walk, in normal walk, not major, but there's rotation there, and the gluteus maximus is responsible for it. Let me continue sharing, but I just wanted to make that very important point. And by the way, it is also one of the reasons why when you hurt your back, they say that walking is one of the best rehabs for backs. And that's for lots and lots of reasons. One of the reasons is walking quite requires you to kind of steady your spine, and it kind of works the muscles in a really healthy way without overextending them and things like that. But the other thing is all that fascia back here ties into my glutes, and it starts to help that repair and strengthen and all that kind of stuff. And that's why they recommend walking usually for back problems. There's about 14 reasons, but still, those are two really good ones. Okay, so if we peel this muscle off, this gluteal muscle, because up here is the gluteus medius, you can see part of it, but I want to be very clear, part of the gluteus medius is under here. So if we peel it off, what we've done here is we've sliced off this poor person's gluteus maximus, and now we have the gluteus medius. It's a very complicated kind of muscle here, actually. But it essentially inserts into the lateral aspect of the greater trochanter. Remember, the greater trochanter is the big bump on the side of your hip that everybody can feel, right? It's the bump that we're careful about when we're massaging up people's legs because we want to get close to it, but we don't want to kind of run over all these bumps. And because it's on the side, it can cause an abduction of the hip. Now, the reason they also say flexion and medial rotation is it's a little bit in front, but that's a stretch, it really is. So, it attaches also essentially to the just underneath the crest of the iliac crest, just underneath here. And it inserts into the lateral aspect of the greater trochanter, and that's why it can do an adduction. Now, if we peel this off, because underneath here is going to be gluteus minimus. So let's look. We've got the gluteus maximus here, Gluteus medius here, and the gluteus minimus. And the gluteus minimus really grabs in front. So they talk about abducting, and that is true, but I really want you to think of it as a flexor of the hip. It grabs in front so it can lift my hip up in front. And so your 3 gluteals really do 3 different things. The one in back pulls your femur back. The one on the side pulls your femur out to the side, and the one in front pulls your femur to the front. And in that way, they really are like the deltoids of your hip. I mean, that is a way to look at them. You have to stretch some things a little bit. I also, for a change, want to talk about nervation. Nervation means what nerves come out of what place in my spine to feed these muscles. So let's talk about that. Let me stop sharing again. So remember, nothing happens in your body unless a signal comes from your head, right? My head says move something, and it sends an electrical signal down a wire. Does that wire run way out here and attach into my glutes? No. Every wire runs through the spine and then shoots out the side of the spine wherever it's going. So the wires that come up, there's a giant wire here, a whole bunch of wires, but when they get to the neck here, some split off and go down the arms. When they get to the thoracic region, some split off and come here. In the low back, some split off and feed the glutes. So when people have low back problems, because the nerves that feed the glutes are like coming out of L4, L5, S1, and they come out and feed the glutes, they tend to have hip problems. Because when the nerves get pinched here, they cause these muscles to be irritated too, or to lack strength sometimes, or all sorts of problems. And when the glutes are having problems, that tends to cause low back problems. And low back problems tend to cause glute problems. And glute problems tend to cause low back problems. I hope you see that I'm saying the same thing over and over again. The nerves that feed your glutes come out of your low back and your sacrum. So the glutes cause tension in the low back. Tension in the low back tends to cause problems in the glutes. Those wires get pinched down here. So anytime I have a gluteal problem, I work low back, and anytime I have a low back problem, I work gluteals. Even if I don't know what's going on, that's just kind of a general thing. To me, they're not glutes, they're hips, and really I look at the gluteus maximus as part of your low back. You know? I don't even, by the way, and you guys have to make your own decisions about this. Please, please, please measure your client. Make sure that you're dealing with a client that you read well. But if I have a client that seems comfortable with me and I'm working through the sheet, I don't even ask about working on glutes. If I'm working through the sheet, I don't even ask about working on glutes. I just do it. If my client walks in and because they're glutes, I don't even understand what the discussion is here. It's not a sexual part of the body. It's nothing. It's your glutes. It's a giant muscle on your bum, right? And I work them direct without even talking to the client. Not direct, through the sheet. Now, if my client seemed shy, if my client seemed freaked out, they got a male. If I was going to drape around the glute and actually expose their glute, yes, there is discussion happening at that point. But for me, just to put my fist in your glute, wiggle your leg around, I'm doing that. That's just part of my normal massage. That's not a discussion to have as far as I'm concerned. And it's something I do in every single massage I do, unless you came in with some specific thing that I was working on that meant that I was never going to get there. I can't imagine a massage without at least general gluteal work. I just can't even fathom it. It'd be one of the places I would never miss. Miss Green.
I had a client during clinic that asked her if she wanted me to work on her glutes, and she was like, "What's that?" It's like, basically your butt.
Yeah.
And she's like, "That's kind of weird, is it not?" And I was like, "Why would it be weird?" I was like, "It's only weird if you make it weird."
Yeah. Yeah.
Like, I don't know what made her think in her mind, like, I would, like, try to touch her like that. You know what I mean? So it's like, I still ended up doing it, like, to show her or whatever, and she ended up really liking it.
I always do.
Her lower back was hurting and stuff, and I was you're probably gonna need them worked. And so I did it, and she enjoyed it. But I just thought that was so funny that she didn't even know what it was, and before she even could experience it, she was so closed-minded, like in a way, like oh, that's weird, like that's awkward, like hi, I'm a female, like it would be maybe weird if a male that you didn't know did it.
Well, be very careful. Don't assume that, because people have all sorts of gender associations and all sorts of stuff. I've heard all sorts of reasoning behind that. So be very careful to think because you guys are the same sex that it's not weird. I know that makes sense, but I've had lots of situations where that was not the case. I once had a woman come to me and she goes, I only have men work on me. And I was like, that's a little unusual, actually. And she's like, the only person that's ever seen me naked is my husband. And I only actually feel comfortable having a man work on me. I was like, oh, like you think the opposite, but no, like people just tell you all sorts of stuff, right? It is interesting. So you guys have actually the hardest job in the world, really, right? Because this is a case in point. If you say to somebody, is it okay to work on your glutes? You've already made it weird. Why are you asking me if it's okay to work on my glutes? Is there something weird about working on my glutes? What are my glutes? Why aren't we using normal terms right now? You've just made it weird. It's why I don't like asking about secondary contact. When therapists ask about secondary contact, it's the most confusing thing in the world. The whole massage is secondary contact. I'm touching them. Secondary contact, by the way, is like if you rest their leg on your leg to work on them. I don't ask that. And I don't do the type of secondary contact I need to ask. If I need to ask, I shouldn't be doing it. So you guys have a really hard world, though, what I wanted to say, which is if you don't address things at all, that can cause problems. But if you address them too much, it makes people think, well, why are we making such a big deal out of this? Right?
Yeah.
So sometimes go ahead, ma'am, please.
I know for clinic, I know Mr. Ibarra was stressing to us that we needed to make sure we were asking people if they were comfortable with that.
Yes.
So that's the only reason why I asked. Typically, I would just do it. Yeah,
and by the way, he's not wrong, and I would say most employers would actually agree with him. And you know that I'm super liberal and he's super conservative. What I'm actually suggesting is, and I'm not just trying to be politically correct with Mr. Ibarra, I'm suggesting we're both right, and what you have to do is you have to read your client. So I think I have clients that I act like Mr. Ibarra with, right? They come in, they're like, I've never had a massage before, and I didn't know I was going to get a male. That client I'm going to talk to. That client I'm going to massage differently. That, right? Yeah. But then I get other clients who walk in, they're like, hey, how you doing? High five me. I'm not talking to that client about working their glutes to the sheet. There's nothing to talk about. This client's fine. So that's what I meant. Your world is really hard because you have to do that stuff. The other thing I do too is I sometimes refer to glutes as hips. And I will take my fist, and Mr. Singletary kind of did this with me in a way. You did it differently, Mr. Singletary. You're asking where it bothered me, but it was very clever what you did. He actually touched my body. He goes, how you doing here? How you doing here? How you doing here? He just really quickly kind of checked in with me. It was very clever because people don't know what their cervical region is. They don't even know what their low back is. I've had many people say my middle back, and they really mean their low back, or they don't know. So anyway, you can actually take your fist and just touch the top of their hip when they're face down and be like, is it okay if we work on your hips here? And they'll always say yes, because they're like, oh yeah, it is my hips. I don't even introduce this thought that it's anything else. You know, it's very tricky. It is very tricky. And by the way, Mr. Ibarra's not right. There are some people you better check on everything, but usually you can kind of tell by how that conversation's going. Mr. Singletary, please, sir.
What I was doing is palpating you because I think this is the easiest way to figure out and then start saying terms that these people probably have no clue what I'm talking about.
That's what I loved about it, sir, is you didn't. Yeah. You'd think we'd want to show off, but actually it's kind of rude to talk to somebody in a language they don't understand. So he didn't use words like cervical or even back or neck. He just touched me and went, how are we doing here? And he was palpating me, and he's already kind of introducing his hands to my body. And what was funny was you did make me think, how am I doing there? You know, it was very clever, sir.
Because some people forget, I forgot my back. Oh,
yeah.
I forgot this. Yeah, that does hurt there.
Yeah.
Even though you've already asked them, do you have any other problems I need you to be aware of? They forget. It happens.
Yeah.
You're human.
Yeah.
And then until you start going over, and then, that does hurt.
Yeah. Yeah. Cool. It's Clayton.
That assessment that you're talking about, did he do that like a full body assessment at the beginning with compressions, or was it like before you started a specific area?
It was in the beginning, kind of with his compressions, and it was very quick. I didn't feel like he was wasting time. He just, as he's kind of compressing, he's like, "How are we doing here?" He's kind of talking to me, and maybe kind of realized like, "Oh, yeah, my low back hurts," but he never even called it my low back. He just put his hand there, and he kind of put his hand on the top of my hip. It was very non-invasive, but he's like, "How are we doing here?" And I was like, "Oh yeah, it's a little sore." It was just it was very clever, and it was kind of getting to know each other kind of moment, But I loved that I wasn't filling out a form and saying, "Yes, my shoulder hurts," right? It just felt so, I don't know, it felt very personal in a good way and casual too in a good way.
Okay. Cool.
But yeah, but he did it during his palpation time. And sure, he's feeling my body at that time, but he's also asking me like, "Does your neck hurt?" Without saying my neck. It was kind of cool. I've never had anybody do that before, actually. It was very neat. Good job, Mr. Singletary. Very cool. All right. So, last bit of sharing here. We'll talk about homework, because I know you guys miss homework. Mr. Richards actually called me several times over break and asked if he could have homework. For everybody, by the way. He didn't just want it for himself. He made sure to include you guys.
I thought the new girl was taking my place. Now you're back on Lisa.
No. Okay, so I just wanted to show you this last slide because it's very useful. It shows you the origin and insertion for each muscle. So here's the origin for the gluteus maximus, and it goes over to the femur and the IT band. They don't show you that. It's out here, right? Here's the origin for the gluteus medius and the insertion for the gluteus medius. Here's the origin for the gluteus minimus, and they have to flip to the front to show you the insertion for the gluteus minimus. But look at how much origin is taken up. Basically, the whole inner crest, a lateral crest of your ilium, the whole side and back of your hip is glutes. Glutes, 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 glutes. This truly is the center of your body. Truly the center of your body. Yeah. I think. Yep. Boom. By the way, a lot of times when I approach people's glutes, I don't approach them like this. I don't cup somebody's buns and then ask them if it's okay to work their buns. I use my fist and I put it in the side of their hip here. If I was going to ask and say, "Is it okay to work your hips in here?" And then they're like, "Oh yeah." Then they realize what I mean. I would probably ask somebody if I was going to start kneading their glutes, which there's nothing wrong with. It's a great technique, but then I'm actually kind of grabbing their glutes, and it's a little more invasive feeling, and then I might talk to them. Whereas a fist in your butt does not feel invasive. A forearm in your butt doesn't feel invasive. I wouldn't ask about that. That's just me. Okay. And here's gluteus medius and minimus, kind of on the side of the hip. We will be doing some hip work in lab coming up here soon. I am going to come in and talk to you guys about how do we get into these really tight spots in the hip without violating our client and all that good stuff. And that is the gluteal muscles. Yay, gluteal muscles. Yeah, we will be doing more review for the next 3 weeks because today was a disaster. And I mean that lovingly and as a joke. But anyway, so we'll do a little bit of that at the beginning of each class too as well. You guys have, let's see here. I want to make sure I'm not lying to you again. You actually have a couple pieces of homework. You have, well, if it shows up on my screen here, bear with me. Sorry, my computer's refreshing. It's trying to refresh. There we go. You've got a video on the glutes, test on the glutes, and a matching from your massage therapy chapter 13 on reflexology, because we're going to talk about reflexology next class, which is fun. I like reflexology. I think it's cool. So let's see, it's 3 assignments. They're due tomorrow, 8 a.m. Nothing changes there. You do have 20 minutes to work. You can probably get through one of these easy right now. Miss Everson, please talk to me.
If we open the new semester